Hello everyone, I am Dr. Elankumaran, a cornea transplant, refractive and cataract surgeon. Currently, I am the medical director of Navashakti Netralaya, which is a super specialty eye hospital situated on Outer Ring Road, HBR layout 5th block near Nagavara flyover, Bangalore. It is difficult for a child to say that he has an eye related or vision related problems. So it is all the more important for the parents to look for these. In a newborn child, usually we say that the child has a very poor vision, what we designate as 6/120 vision. This vision improves by around 3 months of age, when you can notice that the child looks at objects, colored objects particularly, which are placed near and tries to reach out for this. If the child does not reach out for close by objects at around 3 months of age, that is the first warning sign. Also remember, the child has two eyes. So one eye might be normal and the other eye might be abnormal. So a simple test that can be done at home is just to close one eye and see whether the child is able to pick up his playthings with the other eye. As the child grows, there are other symptoms that can be noticed. Like, he will be clumsy. He will try to avoid looking at distant objects and looking at light. This is called photophobia. He will start rubbing his eyes. Also, when the child is looking at things, his eyes will keep fluttering movements, either up and down or sideways. This is one more very important sign to say that the child has less vision. The other important sign is continuous rubbing of the eyes when he tries to look at objects. As the child grows up, we can notice that his activities, particularly the outdoor activities, he would like to avoid because his vision is poor. Another very common finding what we see in these children as they grow up is they will try to sit close to a TV or close to a picture or try to bring a book very close to their eyes while reading. This is one more very important sign that the child has poor vision. Very rarely there are complaints from the school that he is not able to look at the blackboard, or poor performance in the school, that this child is not actively performing. Also remember that these children initially might be normal and a poor or a poor vision can develop later on. Hence, periodic checkup in the school and by the parents is required to detect this condition. There are certain other signs in a newborn that help us find out whether the child has poor vision. Common among this is continuous redness of the eyes and appearances of a white object in the pupillary area. Normally, the pupillary area is black. If there is any white colored structure that is appearing there, then they have to contact the eye doctor immediately. If the child has problem in only one eye and the other eye is normal, it is difficult to find out that this child has a problem. So it is important to close one eye and check. The other method to check is if the child has a squint or strabismus, or if the child is squeezing his or her eyes to look at a distant object or a near object. And lastly, if there is a tilting of the head or the eyes to one side, that may also indicate a vision problem.